You were in a car accident months ago. Your MRI came back normal, and yet your neck and upper back pain is still there. That situation is more common than most people are told, and it often leads to confusion, frustration, and self-doubt when everything looks fine on paper but does not feel fine in your body. Here is the key misunderstanding. Many people assume that if imaging does not show a clear injury, then there must not be a real physical cause for the pain. Standard medical imaging is excellent at finding certain types of damage, but it is not designed to detect every injury that can continue to cause pain after a car accident. When those limits are not explained, symptoms can feel dismissed. That does not mean the pain is imagined or that you are failing to heal. Often it means the results are being interpreted without accounting for how post-injury neck pain actually develops. This is why, in many cases, we use a special type of X-ray testing that measures how the spinal segments move. It can reveal subtle instability and ligament injury that routine imaging is not designed to detect. In this video, I will explain why your neck pain can linger long after a car accident, what standard imaging often misses, and how advanced but very inexpensive motion-based testing can reveal answers that change your next steps. Keep watching. Hi, I'm Dr. Nutche. I'm a chiropractor with offices in Philadelphia and Northeast PA with over 2 decades of clinical experience treating complex spine, nerve, and soft tissue injuries. I focus on advanced diagnostic testing, especially spinal ligament injury and precision X-ray analysis, because too many people are told nothing is wrong when the real problem simply has not been measured. I started my practice after watching years of physically demanding work leave my own father in chronic pain with no clear answers. That experience shaped how I practice today. Instead of guessing, we focus on objective testing to identify instability, alignment issues, and injuries that standard imaging often misses. On this channel, I break down why chronic neck pain, back pain, and headaches persist, explain what imaging can and cannot show, and walk you through modern regenerative options so you can make informed decisions about your health. If you want clear explanations, real answers, and a better understanding of what is actually causing pain and how the body can heal, subscribe to my channel. My goal is to give you clarity, confidence, and a smarter path forward. It is very common for people to walk away from a car accident, or any injury for that matter, feeling mostly fine, only to start dealing with neck pain, headaches, stiffness, or back pain weeks to even months later. That delay is one of the most confusing parts of injury recovery, and it is also one of the most misunderstood. Right after an accident, your body is flooded with adrenaline and stress hormones. Those chemicals are powerful. They temporarily reduce pain signals and increase your ability to function. That is why many people say, "I felt okay at first, and then everything changed later." As those chemicals fade and normal movement resumes, injured tissues begin to protest. Pain shows up, stiffness increases, range of motion decreases, headaches become more frequent. Medical research has shown that whiplash-associated disorders and other spine injuries often develop over time. Ligaments, discs, and connective tissues can be damaged without tearing completely. They become inflamed, weakened, or stretched. These tissues are slow to heal, and when they are injured, symptoms do not always appear immediately. This is not rare, and it does not mean something went wrong with your recovery. The real problem starts when delayed symptoms are met with normal imaging results. When someone hears that their MRI or X-rays look fine, they often start questioning themselves. They wonder if the pain is exaggerated. They worry that nothing serious is happening. That doubt alone can be incredibly discouraging, especially when the pain keeps interfering with daily life. Here's the key point to understand. Pain that shows up late and does not resolve is still real pain. The timing does not make it less valid, and normal imaging does not mean the injury is insignificant. It often means the injury exists in a form that standard tests are not designed to detect. And that brings us to the next critical question. If traditional imaging looks normal, what exactly is being missed, and why does that matter so much for your recovery? To understand why pain can persist even when imaging looks normal, You have to understand what those tests are actually designed to do. MRI and standard x-rays are very good at finding certain types of problems. They can identify fractures, major disc herniations, tumors, infections, and obvious structural damage. When those things are present, imaging is often incredibly helpful. But most post-accident neck and back pain does not come from those kinds of injuries. It comes from tissues that are meant to move and stabilize the spine. Ligaments, joint capsules, and supporting connective tissue do not always show clear damage on static imaging. An MRI takes a snapshot while you are lying still. A standard neutral x-ray does the same thing. They show structure, not function. This is where a major misunderstanding happens. When imaging does not reveal a clear injury, many people are told that nothing serious is wrong. The problem is not that the test failed. The problem is that the test was never designed to answer the question being asked. Persistent pain after an injury is often a problem of abnormal motion, not broken structure. If a spinal segment moves too much or moves in an abnormal pattern, it will irritate nerves, overload joints, and keep tissues inflamed. That instability can exist even when everything looks aligned and intact on a still image. So the scan looks normal, but the spine does not behave normally during real movement. When this difference is not explained, patients often feel dismissed. They feel like their symptoms are being minimized or misunderstood. In reality, the issue is that standard imaging tells only part of the story. To fully understand lingering pain, you have to look beyond what the spine looks like at rest and start asking how it actually moves. And that is where the conversation shifts from what you can see on a neutral x-ray to what is happening beneath the surface, in the stabilizing structures that hold the spine together. When pain continues long after an accident, one of the most common underlying issues is damage to the ligaments that stabilize the spine. These ligaments act like tension cables. Their job is to control how much each spinal segment moves and to keep motion smooth and coordinated. When they are stretched or injured, the spine can begin to move in ways it was never designed to move. This kind of injury does not always cause sharp pain right away. Instead, it creates subtle instability. Certain segments move too much. Others compensate by tightening up. Over time, that abnormal motion stresses joints, irritates nerves, and keeps surrounding tissues inflamed. That is why people often report symptoms that feel inconsistent or even hard to explain. Some days are better. Some movements trigger pain. Headaches come and go. Stiffness builds after activity or even after rest. This is why treatment that focuses only on symptoms often falls short. If the underlying problem is excessive motion between spinal segments, massage, medication, or generic exercises may provide temporary relief, but do not address the source. The instability remains and the cycle continues. Pain quiets down briefly, then returns. What makes this especially frustrating is that ligament injuries don't show up clearly on standard imaging. The ligaments may look intact, but their ability to restrain motion has been compromised. The injury is functional, not obvious in a still picture. Until that instability is identified and measured, it is very difficult to explain why pain persists or how to treat it effectively. This brings us to the most important shift in evaluation. If the problem is abnormal movement rather than visible damage, then the solution has to involve measuring how the spine actually moves, not just how it looks at rest. In this next section, we will look at how advanced instability testing does exactly that and why it changes the entire conversation about your recovery. If persistent pain is coming from abnormal spinal movement, then the evaluation has to change. Instead of asking what the spine looks like while you are lying down or standing still, the better question is how those spinal segments behave when you move. This is where advanced instability testing becomes critical. This type of testing uses standard X-ray imaging taken in either forward bending, flexion, or backward bending, extension, to evaluate motion between spinal segments. Those images are then analyzed using an independent and precise measurement software that looks for excessive or abnormal movement that should not be happening. The goal is to find small but meaningful deviations that explain why tissues keep getting irritated. SpineCamp uses this motion-based approach to objectively measure spinal instability. This technology was developed and is administered through Medical Metrics, a company focused specifically on identifying spinal ligament damage that traditional imaging does not capture. Rather than relying on opinion alone, SpineCamp produces objective measurements that show where instability exists and how severe it is at each spinal level. To make this easier to picture, imagine two bones in your neck that are supposed to move together within a very small controlled range. On a standard neutral x-ray, they look perfectly normal because they are sitting still. But when you bend your neck forward or backward, one segment moves further than it should, while the one above or below it does not. That excessive motion stretches nearby ligaments and irritates sensitive structures. Now imagine that motion happening every time you look down at your phone, or read, or work on the computer. Over time, that abnormal movement can trigger neck pain, muscle guarding, and even headaches, especially at the base of the skull. Nothing looks damaged on a still image, but functionally, the system is no longer stable. What adds another layer of credibility is how widely this analysis is used. The SpineCamp process relies on FDA-cleared technology, aligns with established medical guidelines, and is trusted across multiple disciplines. Specialized chiropractors like myself, orthopedists, spine surgeons, radiologists, and even insurers and attorneys use these measurements because they are unbiased and reproducible. In fact, this technology has been trusted by 19 of the top 20 global spine companies for their clinical trials. The analysis is performed independently, which helps remove questions about interpretation or provider bias. This matters because spinal ligament injuries are some of the most commonly underdocumented injuries after accidents. When instability is not measured, treatment decisions are often based on incomplete information. By precisely identifying the location and degree of abnormal motion, clinicians can move away from guesswork and move toward care plans that are grounded in measurable findings. Just as important, this testing is non-invasive and uses familiar imaging technology that patients already recognize and is actually very inexpensive. There are no injections, no experimental procedures, no additional radiation beyond standard x-rays. Images are taken right in office and securely analyzed, often with results available quickly, which helps prevent months of uncertainty and trial and error. Once instability is identified and documented, with this level of precision, the focus shifts from searching for answers to using those answers. Next, we will talk about what this information actually changes for your treatment decisions, your recovery path, and your ability to avoid long-term chronic pain. Once spinal instability is identified and measured, everything changes. Instead of treating symptoms in isolation, care can finally focus on the actual source of the problem. Knowing which spinal segments are unstable and how severe that instability is allows treatment to be targeted and intentional rather than generalized and repetitive. This is where many people begin to feel real relief, not just physically, but mentally as well. When your pain has a clear explanation, doubt starts to fade. You are no longer wondering if you are overreacting or missing something obvious. You now have objective data that explains why pain has lingered and why previous treatments may not have worked as expected. From a treatment standpoint, precise findings guide better decisions. Some people need stabilization-focused care. Others benefit from specific rehabilitation strategies. In more severe cases, the findings help determine when advanced interventions should be considered and when they are not appropriate. The goal is not more treatment. The goal is the right treatment applied at the right time to the right area for the right reason. This approach also helps prevent problems from becoming permanent. When instability goes unrecognized, the spine continues to compensate. Muscles tighten, joints overload, nerves remain irritated. Over months or even years, that pattern can turn a recoverable injury into chronic pain and accelerated degeneration. Identifying the issue early and accurately gives you the opportunity to interpret that process. If your neck pain has not resolved months after an accident, the most important takeaway is this. Normal imaging does not mean the end of the conversation. It often means the next step needs to be more precise. Understanding how your spine moves, not just how it looks, can be the difference between managing symptoms and actually moving forward with recovery. And that is why asking better questions and using the right tools is not about chasing tests. It is actually about finally getting answers that make sense and using them to move forward with clarity and confidence. If you have been dealing with persistent neck pain, back pain, or headaches long after an accident or injury, and you've been worried because your tests come back normal, but your body does not feel normal, I want you to know that there's still hope. Lingering pain does not mean you are broken, and it does not mean you're out of options. It often means the right question has not been asked yet. The most important next step is finding a doctor who understands spinal instability and who does not stop the investigation just because routine imaging looks fine. You want someone who knows how to evaluate motion, ligament injury, and function, not just structure. That difference matters more than most people realize. If you need help finding a provider who does this type of testing, leave a comment below. I will do my best to help point you in the right direction. And if you're in the Philadelphia area and would like our team to perform this testing for you, we'd be glad to help. You can call our office to learn more about whether this evaluation is appropriate for your situation. If you found value in this video, please like it and share it with someone who might be struggling for answers to their neck pain, back pain, or headaches. You never know who needs to hear that their pain makes sense and that there is a path forward. And remember to subscribe if you want clear explanations, real answers, and a better understanding of what is actually causing pain and how the body can heal. Thank you for watching, and I will see you in the next video.